Nothing is more inspiring and exciting than helping the ones you love. This is a true story of my father's medical adventure. He's with me today, and I will read you exactly how he expresses his own fight for health. These are his own words of his letter that he wrote. And he says, never give up. Remember, never give up. And I'm gonna read his words. There are always many methods and treatments besides conventional ones, well known to us and recommended by the doctors. I hope this story will be a good source of information and will help someone in similar situation to face any sickness. My journey, he's saying, to health began when I was 75 years old. I felt good and I did not take any medication unless I had a cold or runny nose. That's why in January 2019, I bought a ticket from Krakow to Chicago to visit my daughter, me, and her family. Unpredictably, everything was suddenly canceled. On the New Year's Eve, instead of planned trip to the States, I suddenly ended up in the hospital because of my heart complications. The test showed serious cardiac problems, some changes, heart failure, along with arrhythmia and hypertension. The struggle for survival began at the turn of the year and lasted for several months, including hospital, sanatorium treatments, and home rehabilitation. Fortunately, despite that fact, I had a lot of support from my family living here with me in Poland, as well as from United States. When I was admitted to the cardiology department in my hometown for the first time, I was initially treated for bradycardia, which is 40 heartbeats per minute, and ECG. On admission to hospital showed sinus rhythm, and it showed a decrease in blood pressure by up to 48%. I started exercising on a treadmill, but I had to stop because of increased arrhythmias. Every day it seemed to get worse. So when I was qualified for the bypass surgery, in desperation to improve my condition and my health, I wanted to try other methods, and I did not agree. Actually, I even refused this type of surgery that was strongly recommended by heart specialists. Then the first angioplasty was performed, and after a few days I was discharged from the hospital and went home with some new strict lifestyle recommendations, like doctor's orders to take several heart medications, low-calorie diet with reduced fat content, as well as periodic inspections at the cardiology clinic. A month later, my cardiologist again placed me in the hospital and performed another stenting, and in 2 subsequent operations implanted 3 additionals into my arteries. After that, I underwent a procedure of ablation. This treatment was effective and reduced my arrhythmia. During my further stay at home, I systematically did the necessary periodic examinations. Every day I recorded my blood pressure measurements and took the assigned test of drugs. Despite all these changes, I still had the big disadvantages of getting tired when walking, frequent leg cramps, and chest pain. I experienced less physical activity, and what was worse, I started to notice weight gain despite my moderate appetite. To counteract this, my family in the US insisted on coming to Chicago to be checked by American specialists. Although my doctors in Poland were very opposed to my plan, I went on a long trip to US.
Okay, go!
And decided to try different methods. Here, I met with several cardiologists who recommended the same thing, a pacemaker or the bypass surgery. However, my daughter was determined to find a better method and avoid any surgery. After an extensive research, we found clinic with Dr. Christian Farjat in Queretaro in Mexico. Doctor successfully uses chelation method and uses stem cells for endocardiology treatment and other diseases. Paco had the same problem as my dad because it was all with heart, right, issues and the pressure. Widzisz, jak mu wsadzili rozrusznik? Yeah. And that was not necessary.
Yeah, it's still there. Yeah, but now it's inactive.
How long ago?
It's inactive. About almost 8 years.
Unfortunately, those treatments are either very, very expensive in US or just not available.
And the FDA, our FDA, your government, says that you can't do this. Our doctors can't do this.
At first, I wasn't entirely sure if in my case, after so many surgical procedures already done and months of drug treatments, I would still be a suitable candidate for the method called chelation. In the situation I found myself to try to improve my well-being, I decided to give a try. On February 15th, 2020, I flew with a group of other patients from Chicago to a clinic in Mexico to start the treatments. After performing detailed blood and urine tests in the lab called CHOPO, I was qualified and admitted to the clinic by Dr. Christian. Good for you. Within 10 days spent in Querétaro, I received 10 chelation infusions.
My chelation therapy, they just removed my IV right there, as you can see. Right there, there's the proof of it. And feeling very well relaxed. We're taking a little extra care in the case of here, my dear companion, Mr. Zana. So he has a heart condition, so we don't put it to the same IV at the same speed.
Each infusion contains a special set of chelators, especially EDTA, that cleans up the veins from all heavy metals and calcium. I have to admit that with each day of treatment, I felt a significant improvement.
He was
7
pale
treatments.
the moment I first
And
saw
swollen.
him, and swollen at his feet. Now, look
There's-
at his rosy cheeks, healthy rosy cheeks, and healthy heart erections.
Flow of life energy, no more leg cramps, and no more pain in my lower back, which allowed me more freedom of movement. No, mówię ci, że to
Just a
zeszło.
little bit down, but
But this,
very,
it
very-
was like,
yes.
I couldn't see his bones and things.
Odczuwam, że nie bolą mnie
Oh,
tak
and there was
krzyże
one more thing after
i
chelation.
biodra. To mi
He had
nie
a huge
pozwalało
pain in the lower
swobodnie
back,
chodzić.
non-stop. Like it really stopped him from, having pleasure and flexibility of walking. And this is all gone. And already after a few treatments, the blood pressure, since my initial record 173 by 110 by 95, dropped to 130 by 73 by 75. As a result, I gradually reduced my medications and even rejected taking some of them. It felt just great. An important convenience during these procedures was that Dr. Christian Farjat arranged the schedule for each patient. In our free time, we were still walking, exploring Querétaro. There are so many beautiful old parts of that charming town. And also, to my surprise, a very modern architecture. To stay in a larger group of people who are receiving all kinds of treatments according to their diseases, we were also able to travel more and visit in nearby cities like San Miguel de Allende, Guadalajara, city of Ajijic or Lake Chapala. All have a lot to offer. And we have a lot of photos, drawn images, we have great memories, and hope that one day we're gonna return there again. At the end of my stay in the clinic, apart from chelation, I also underwent a procedure to receive the stem cells, which in my case were to make my heart muscles stronger, but most importantly, to restore the body's immune system. 3 weeks after my return to Chicago, I found that my blood pressure, first time from a long time, was practically normal. My lower back problems were gone, and most surprisingly, I could only occasionally reach for a tablet only during the weather changes. And I must emphasize that before leaving the clinic in Mexico, I was also consulted by Dr. Stephanie Farjat, a dietitian specialist who designed for me a type of a new diet, which was according to my health and age, including exercises, of course, daily walks, and outdoor activities. This allowed me to reduce my body weight by 14 pounds within my first month. As I mentioned earlier, at the end of my stay in Queretaro, in the same clinic, I received stem cells that were prepared by doctor in accordance with my cardiovascular needs.
Stem cells give.
The procedure is very quick, done with 4 simple injections, and I swear it was painless. The only side effect I noticed was the redness of the skin around the cell injection site. Besides, I felt very well.
Be needing electrocardiogram, echocardiogram around 6 months after.
Okay, so if he doesn't, I'm gonna send
be
you the...
ready to be surprised.
I must indicate that both treatments gave me a lot of energy, positive thinking, and all above, basically, more hope for a better tomorrow. Feeling stronger, I was able to dance in the beautiful Querétaro parks, where people love to gather together to spend time, especially evenings with music. I tasted really good street food. I met new people, including some Americans who moved to Mexico for their retirement, visited their houses.
What we've seen, both of us, and here, is so different in the medical profession because, first of all, they're not scared to death every moment that they're going to be sued for malpractice.
Right.
Secondly, I don't think they're owned and paid for by the drug companies the way the American.
I'll give you a little example. You want to get your teeth cleaned? $18 US.
Wow. And $175 in US.
That's right. That's right.
So all these little things add up and count. And the medical here, they are so advanced.
And your husband said that
Same
they're
that.
wonderful. The 3 hospitals right nearby.
Well, not just that. There, in Guadalajara, there's I think 6 million people. It's the second largest city.
Right.
And they've got a lot of teaching hospitals there. And one thing that we found out here is that you have to have an academic standing before you can become a medical student.
Okay.
And then it's free. You don't pay for anything. The government pays for it. So they get the best of the best. And for instance, I've got my doctor's cell phone number. Call him anytime. I can call him at.
You don't need to wait 3 months for one appointment?
No, it's right on his business card, his cell phone.
And local markets, and enjoyed the fantastic weather of Mexico. The funny thing is that one aspect of the stem cells that the doctor and other stem cells recipients mentioned to me was that usually men regain their sexual vitality and incredible power. Should I call it a side effect or a natural secret weapon instead of Viagra? Anyway, now I know it's true. I'm writing this letter to document my trip for myself and anyone who suffers and struggles with the same or similar issues that I had. I was hopeless. I also decided to describe my experience and tell my story because I really would like to express my gratitude.
Objective and very specific symptoms that actually his treatments are working right now. Not in a month, not in a year, right now.
And appreciation to Dr. Christian Farjat and his medical staff, to all the people who looked after me throughout the entire stay in the clinic. I feel much better. I lost a lot of weight. I stopped taking medical drugs, replacing them with a new lifestyle, which is for sure healthy food. We're doing little shopping of the organic items. Exercises. Yeah. Woohoo! Stem cells revolution. 75 years old on the electric scooter. Nothing is impossible. Yeah! Is it fun?
Łatwo, co? Dobra. Jeszcze raz.
Jeszcze raz spróbuj.
Do tego. Ja sobie to kupię. More walking, a lot of positive energy.
Oh my goodness! Oliver! Treatments, my blood pressure has normalized. I regularly keep records of my blood pressure measurements, and I will be sharing during my monthly visits all those records with my cardiologist in Poland. I hope that everyone in need will be able to experience such a positive change, a transformation that has transformed my life, and I'm sure can also change yours.
Okay, I'm here with my grandpa Zenek. He is 74 years old, and just about a year ago, he had the problem and issues where he wasn't able to walk or function normally like a normal human being would, and he had difficulties doing everyday things. And turns out, after reading, his blood pressure was very low, and turns out he was having a lot of issues with clogged veins. So for the longest time ever, he wasn't able to do anything, and he was going around hospital to hospital in Poland, and the one thing that they were telling him was just basically take pills, even saying like to have a pacemaker and stuff like that. It's just like the standard things, and which, I mean, like it does work for some people, but it's not the ideal method. But we brought him over here just to see if there's any alternative methods here in the US, and turns out here it's very expensive, especially for someone that doesn't have insurance. And there are a lot of methods here that are very advanced, but like I said, they cost a lot. And so about a year ago, when I went for a procedure done for me, I went to Queretaro, Mexico, and there's a clinic over there in which it's very high advanced medicine, and very intelligent doctors over there working over there, and he has his own clinic and own practice, and it was an absolutely beautiful experience, and I was able to get out of the clinic very fast, and it was great. So we decided to take a gamble on that and bring him over there, and after being there for 2 weeks, he came back here, and I believe it was like 7 days right afterwards, he completely got off all medication, and he started to say, in his words, he started to feel like he was 40 again, which was absolutely insane. And now he's 74 years old, and to think that in just a year's time, he's able to go over a mile on a treadmill now at the age of 74. He's walking normally. He's lost 20 pounds, and this has only been like 30 days since he's gotten back. So it's absolutely extraordinary, and I can't wait to see the progress growing. So congratulations.
I wish everyone in need not to be afraid of this method of repairing their health, because it's really, really worth it.
Hello, this is my healthy grandfather over here. About a year ago, he was in Poland and he was diagnosed with a really bad heart problem, and he decided to come to the United States to spend some time with our family. And my mother decided to take him to Mexico to the best doctors for some really good stem cells. Once he got to that therapy, he did that therapy for about 2 weeks, which I saw with my own eyes that it was incredible. It was phenomenal, and it was the best experience my grandfather could ever get. On his way home, he was very excited. He said the process was really easy, really relaxed, and when he got here, him and I decided to exercise a lot, which I'm talking like once a day, and he was able to complete a mile on the treadmill in less than 20 minutes, which was spectacular. And we would run that routine every single day. He would cut off unhealthy food. He would eat very good food. And he, over that time, within those 2 months that he did his therapy, he's lost about 20 pounds. And I see him, he's very happy, he's very healthy, and he's very excited about it. And the people in Mexico, the doctors, they are extremely amazing and really, really helped out my grandfather. Thank you.
If you wish to talk to me, I can always exchange more details as a phone conversation, by email, or even personally. That was my dad, Zenon Kivior, and the number to call for more info is 773-716-4700. And I'm Ilana, his daughter, and the most proud daughter in the world. Mwah.